So I'd like to welcome you to Research Showcase and to the panel from the Schubert Center for Child Studies and other collaborating centers around the campus interested in children. The Schubert Center has as its core mission to bridge research practice and policy. We have a wealth of research at the university on children and childhood issues, and we seek through many of our activities, some of you have been to our programs, to bridge the research and the practice and the policy. What are the implications going in all directions? And so we do a variety of things. We have some publications. I brought outside there some of our materials. David Miller did one of our policy briefs. Molly did another, where we try and talk about research and its implications for practice and policy. Our panel today, we are very thrilled to have this stellar group of people who agreed to join us today, and we're very grateful. And today we thought that unless you're asleep, the impact of the economy on children is something that is on all of our minds every day, all the time. And so our intention was to bring together this panel of people with a range of expertise to talk about what the impact of the economy is on children and youth, what some of the critical issues are in these times of really scarce resources. It's both a challenge and an opportunity to think about how we address some of these problems, and we're grateful to our panel today who's going to enlighten us about these issues. And so again, the Schubert Center is very pleased to welcome this group, to welcome you in the audience. We hope we'll have a lot of discussion as we move forward. Molly Irwin is our the director of our Child Policy Initiative that's been generously supported by the Gunn and the Cleveland Foundations and by the Schubert Center also. And she's going to introduce our panelists and the session. So thanks very much.
Great. Thank you. I'm going to do fairly quick introductions because I believe everybody in their booklet has the names and bios of all of our panelists, so I'd rather give more of the time to them. But let me just go down the panel and let you know who we are lucky enough to have with us today. And I just lost my top sheet. Our first panelist is Jim Lalumandier, who is an associate professor and chair of the Department of Community Dentistry in the School of Dental Medicine here at CASE. We have Amy Hanauer, who's the executive director of Policy Matters Ohio, Joe Gaunter, who is the director of Cuyahoga County Employment and Family Services. Sorry, that's a tongue twister. Erica Toms, who is a policy associate from Voices for Ohio's Children. And Erica is here very graciously at the last minute. Unfortunately, Gayle Channing-Tenenbaum could not come. And so Erica, who has a great deal of expertise, decided to agree to stand in her place. And finally, we have David Miller, who's both an associate professor at Mandel School of Applied Social Sciences here at CASE, and also a councilman at large in South Euclid, Ohio. So he brings us a couple different perspectives. And what we've asked the panel to do today is to really reflect on 4 questions that get at what's going on with the economy and how that impacts children. And I'll just go through those questions quickly and then turn it over to the panel. So first we asked them to think about what impact the economy is having on children and families, and specifically, depending on who they are and where they sit, to think about things like, are the number of children and families who are applying for or receiving services changing? Are you seeing changes in families that you are dealing with in your work? The second question is, in what way is the economy affecting the services and policies for children and families? For example, when you look at budgets at the county, state, or federal level, are we seeing changes based on the economy? The third question, how is or should be research and policy coming together to address or inform policy in this economy? And one of our real goals at the Schubert Center is to really think about that connection between research, policy, and practice. So we really wanted to think about how is or could research be helping at this time? And finally, what data or research is needed to help formulate policies for children, and to think not only do we need more information, or do we need to think about how to use or better translate or disseminate information that we maybe already have. So that's what we've asked them to reflect on, and given that, I will pass it over to our panelists. Are these,
Either way.
if these mics
Are
are
these
on, it's
okay?
fine for you guys
Yeah.
to sit there.
I'm Jim Lalumandier from the School of Dental Medicine, and I don't usually follow directions very well. So that's why they probably let me start off. I'll tell you a little bit about myself and what my program is about, and then I'll try to address some of these questions. And I'll give you what I've done this year in the Cleveland Metropolitan School District is I've educated 20,000 children. I've examined and treated 6,180 children and referred about half of those children that we saw. We're in every school in Cleveland, all 85 K-8 schools. So that's what we've done. Why did I want to do it? What brought me to this year? When I first got to CASE, what I noticed was our dental students are cooped away in their own little four walls. They never seem to get out of those four walls. Patients come to them. They see the patients. They treat the patients. They're very kind. They're very good. They're excellent people. However, they don't see any of the environment that our children or our patients live in. And plus, when our patients, our children, come to the clinic, I don't know if you've ever been to the clinic, but it's kind of scary. You know, I'm kind of scared when I go to the dentist, and I'm a dentist. And so these children go to the dental clinic, and they're really nervous about going there. So I thought, well, wouldn't it be better if we just took the dentistry to the individual schools, see the children in their schools, make them more comfortable, do exams there, educate the children by classroom. And what we do is we do sealants, which is, it's like I don't know if you know what sealants are, but basically it's like a resin material that we put on the biting surface of teeth in order to prevent cavities. It doesn't hurt. That's a good thing. There's no needles. A lot of children are very scared of what their older siblings have told them. And so this is sort of like, and a lot of time it's a first-time experience seeing a dentist. When I first started, half of all second graders had never been to the dentist before in Cleveland. And this is Cleveland. We're not talking about Dominican Republic or Haiti or some other foreign country. This is Cleveland. So we target second, third, and sixth graders as far as the education, as far as the exams and the sealants. And then we found out later on we really need to get the education earlier to the children. And so now we have 2 full-time health educators one educating the 2nd, 3rd, and 6th graders, and the other is educating the pre-kindergarten, the kindergarten, and 1st graders. So when we see that 2nd grade child, that child shouldn't be as nervous as they were before. We've been doing this now for 8 years. I started in 2001, going to every school, and so we have 8 years of data. We have 8 years of hopefully happy kids. I'm very fortunate to have a foundation, the St. Luke's Foundation, so if you want to give any money, please give money to St. Luke's. They have given us millions of dollars in order to do what we do. And so, and fantastic folks. So this is where I'm trying to bring, what were my questions now? As far as the economy into what we do. As you know, some of the foundations are having problems, okay, with monies. And starting in 2001, we received X number of dollars, and those dollars have gone up every year. Last year, I received $730,000. This year, we didn't get a raise in the number of dollars. So that's, for somebody who works on foundation funding, that's pretty scary. So I had to do the same thing that we're doing, seeing 20,000, educating 20,000 kids, seeing nearly 6,200 examining and treating children, referral, all those items with the same amount of monies. The other problem as far as our dental providers. Most of our dental providers where we refer our children to do this pro bono. They don't accept any funds. Obviously, they're not doing as well as they were doing a couple years ago. So I see a decrease in the numbers willing to volunteer their time, and that's understandable. On the other hand, we're seeing more kids. So it's not just poor children that are in jeopardy, it's families, middle-class families who have lost their job. And if you don't have a job, you don't have dental insurance for the average person. And so you lose your job, no dental insurance. And even if you need something, that's probably going to be way down the totem pole. You're going to pay your mortgage first and your lights and everything else. Dentistry's way down. So we're getting a lot more kids, and we need to refer a lot more children. And so this economy is obviously making quite an impact on us. I probably haven't answered all the questions, and I don't know if were we supposed to ask questions now? I mean, from the audience, or hold off?
I think at the end.
At the end? Okay. So I was told we're going to have questions at the end. So I think I've covered at least 2 of those. Okay? Thank you.
Thanks, Jim.
Does this have a clock on it? I'll put it here to try to stick to my 10 minutes. I'm Amy Hanauer. I'm the director of Policy Matters Ohio, and I'm really glad to be here today. Policy Matters is a nonprofit, nonpartisan policy research institute dedicated to trying to create an economy that works better for everyone. So I'm acutely focused on the economy and not doing the good work that you're doing on a day-to-day level with actually seeing kids and helping them. So it's really impressive to hear about what you're doing. And I'm really glad to be here today. We've gotten a bunch of terrific interns over the years from CASE. We have a board member who's an economics professor here at CASE. So we just feel like this is such an essential part of this community, and so it's nice to be able to speak on the campus here. So it's a real given that the recession is doing tremendous harm to children now and will continue to harm children. And this is a particularly bad recession. I mean, any recession brings about a number of very difficult things for children, and Joe can talk about that in a much more specific way. But certainly caseloads for temporary assistance to needy families, which is the way we deliver cash to families with children now, are going up. Caseloads for Medicaid are going up. New unemployment insurance applications are at their highest level nationally since 1982, so it's really much worse than the previous recession. Child abuse and neglect always goes up during a recession, and I don't have those new numbers yet. And child poverty will absolutely rise. And particularly with this recession, since it's the second recession since we changed our welfare system, I think it's really a time to take stock and step back and take a deep breath and think about what we did. Because what we did was we put lifetime limits on how long people could receive public assistance for. And that might have been okay during a first recession because that might have been the first time that someone was losing a job during their lifetime. But now that we're in a second recession, it's just an absolute given. We know that people are losing their jobs again, and but people may have already expired their lifetime limits. So it's going to be very interesting to look at. And so we could have research documenting all of these things. We do have research documenting all of these things. Erica's organization, my organization, puts out some of that research. But a lot of this is known to some degree. And so I'll say a little bit more about this as I go on in my talk. I want to just say about this recession that this was a recession that was made much worse by a set of policies leading up to this recession. And again, research was available making a lot of this very clear, and it didn't necessarily change the actions that we were taking. So what we saw from a federal level leading up to this recession over the last generation was extreme deregulation of financial services that made it very, very likely that a lot of people would get into bad loans. And it was this excessive unpayable indebtedness that was really pretty much inevitable because of the deregulation that we pushed through that kind of caused the economic unraveling. We've had a generation-long decline or stagnation in people's wages. So even though our economy was growing very rapidly, our economy was getting much bigger over the past generation, people's wages were not growing. And again, I would argue that that made it somewhat inevitable that the way our economy was going was not going to be sustainable, that people were going to be turning to credit that they couldn't pay back, because if their wages weren't growing, how could they pay back a loan that they were taking out? We had a generation in which we were reducing taxes year after year after year at the federal and state level. And so that left our public systems much less able to deal with the recession's effects. So right now, many states, including Ohio, face a likelihood that their unemployment compensation trust funds will go broke. The federal government will step in at that point. And many states, including Ohio, cut taxes to the extent that their state budgets are dramatically underfunded. The rainy day funds are fast depleted, and we're unable to pay for basic needs. We've also had a lot of underinvestment in infrastructure and basics that leave us needing to deal with that generation of underinvestment at the same time that we're facing this economic decline. Now, I want to be clear. I'm not saying that the government could have prevented this recession. You know, we have a business cycle, and nobody's quite figured out, although we've gotten much better at it, nobody's quite figured out how to prevent the business cycle. But the bad policies, and let me be clear, these bad policies were primarily an over-reliance on markets, saying that markets could solve all of our problems, and underinvesting in the public sector, just assuming that we could solve things through markets. I think those have put us in a much worse position. In addition to the policies that I feel led to the recession, we just have had a number of trends over the past generation that are very troubling from the perspective of children, even during the period of supposed expansion. And Ohio didn't really participate in the expansion. I'll say a little bit more about that in a minute. So as mentioned, we had this wage stagnation. We had this extreme growth in inequality, that leaves, massive numbers of children in the Cleveland public schools never having seen a dentist by second grade. As Jim said, it's not Guatemala, it's Cleveland. This big decline in the safety net, the deregulation that I mentioned, and the rise in debt. We've also seen a huge rise in work hours by families, about an 18% increase in family work hours, whether that's single-parent families or two-parent families. And in some ways, that's a good thing, right? It's great if people can find work. But what that means is that work that we used to expect a parent in the home to do can no longer be done by that parent in the home. So that really increases a family's expenses. If there's not a parent at home to care for children during the daytime, then they need to find someone else who they can purchase that care from. If there's not a parent at home cooking, it's going to increase the need to grab a pizza on the way home from work, which, you know, may not be so, I mean, the pizza might not be so bad for their teeth, but the Coke that they might grab along with it would be. So, you know, so there have been a number of trends that I think are troubling for children. The last one I'll mention quickly is just the decline in family health care coverage through the workplace. And the public sector has tried to make up for that. So there have been some policy changes in the past generation that I would argue have been very helpful to children and families, although I don't think that they come close to compensating for our past generation of policy failures. So we've had a big increase in the federal earned income tax credit. This is the best way that we have of getting cash to working families who are still in poverty or in need, and who, you know, who aren't able to make ends meet. So I'm very supportive of that, and I think it's been an excellent addition to our policy toolbox. We've had a big increase in support for early care and education. Excellent thing. It's very documented how helpful that can be. And we've had increased coverage of children's health insurance through the public sector. And I also want to emphasize that we've had a big increase in spending and in positive outcomes for children with special needs. So we are devoting a lot more resources to special education than we were a generation or so ago. And you know, that's very, very helpful to children in that circumstance. Many of these policies that have helped children, however, are really targeted toward families with working parents, the EITC, the child care assistance, the health care for families in the workplace. And so during this recession, as we have an official nationwide unemployment rate that's nearing 9%, with more than 5 million jobs lost nationally in this recession alone, and much higher numbers in key communities like where Jim works, families are going to be unable to tap into these work supports. So I guess I'll jump past a couple of these more statistics that I have just to make sure that I get to my key point here. So I hate to say it because I run a policy research organization, so clearly I care about research. I've devoted my life to doing research, and here I am at a research institution and speaking at a panel about the importance of research. So it seems sort of off discipline to say that, you know, it seems sort of both rude and inappropriate to say, but the fact is, I don't think that the principal thing missing is research. I think that the principal thing missing right now is will. Sure, there could definitely be more research on the nuances of education policy. Anyone who's doing that work, I salute it, I take my hat off to you, and I would love to read it. You know, we need to figure out how to better educate disadvantaged kids. We don't do a very good job with kids who are in poverty. We're not doing that well by English language learners. But there is so much that we already know and fail to act on. We know how much high-quality early care and education transforms lives. It's so well documented that it's like become trite to talk about. Yet we don't provide it at a universal level. Even though our economy, again, is much more prosperous than it was a generation or two ago. So it's easily affordable. We just choose not to do it. And I would argue that some of the things that we don't know, like how to educate kids who are deep in poverty, we could deal with by reducing the degree to which children are deep in poverty, right? I mean, I don't think there's a magic bullet that a teacher, or a magic wand that a teacher can necessarily wave. I think if you get up in the morning and there's no breakfast and your parent is completely stressed out and you got kicked out of your house last month, it's hard to know how a teacher makes that much better, even though teachers come in every single morning to classrooms all around this city and valiantly try to do so and probably make some difference. I think it's really something that we have to address by reducing the poverty levels. So, you know, policy research can be effective, I think, particularly things that do a good job of outlining costs and benefits, because a lot of what we fail to input on the front end, we end up paying on the back end in terms of incarceration levels for children, or in terms of very high medical costs down the road when we fail to provide preventive care. And I do think that pointing that out can be very, very effective politically. And that is why we did begin to make some excellent inroads on the early care and education, because the research community was just absolutely relentless in pointing that out over and over and over again. And advocates like Erica were relentless in waving those studies around. Okay, I'm going to end on a hopeful note. I try to always do that. So I do think it's more of a crisis of will than of knowledge. But I also think that at times far, far less prosperous than today, we put in place numerous programs that completely transformed lives for the better. So, you know, before we had Social Security and Medicaid, Medicare, elderly people in this society were literally the most likely to be poor. Literally, people ate cat food. Elderly people in America ate cat food for dinner. We put in place Social Security and Medicare, and it's now the least likely group to be in poverty, I believe. And so, you know, we can make a tremendous difference when we choose to. And it was during the Great Depression that a number of the best policies for assisting families were put in place. So I think that the federal stimulus package that's coming through right now, the new Obama budget, really contain a lot of what's needed. They contain massive investments in things that have been long neglected. They might not be quite as big or as comprehensive as I would like, but they really begin to bring us onto a road that recalibrates our policy in a way that makes more sense. And I think that now is a time when we can really demand a better set of policies that leave us better able to meet the needs of families and leave us more prepared for the next downturn and, you know, really enable us to have a more prosperous, sustainable, fair, and equitable society. So I'm very hopeful right now and interested to hear what Joe has to say.
Thank you, Amy. And thank you for offering that message of hope. I don't know if there's a clicker for the PowerPoint or our friends in the PCs are going to move them as I go down the road.
I think she's got to bring up the
Okay.
next.
Can you bring up the next one?
Actually, I think I might. We'll say I've already failed.
Well, hang on a second.
This is why
Well, I'll tell you what, I'm going to start off. The first couple slides really talk about the organization that I work for, just very preliminarily. And so let me do that. My name is Joe Gaunter. I work for the good people of Cuyahoga County. And here we are. We've come up live. So those of you who pay taxes and live in Cuyahoga County, I work for you. So good morning to my bosses, and glad you could be here today. The role of county government in Ohio is really different from many of the other states. Ohio is one of 10 states where there's a bifurcated role. The state has an administrative role. The county is the primary deliverer of human services. And so in that, we go to a lot of national conferences. You know, we said, oh, you're from one of those states where the counties get their fingers in this. You know, so there really is a difference there. The kinds of services in which this is a variance are really, you know, child welfare, protective services. You all can read the list there as well as I can. Really, most of the things that you might think of in talking about human services in the government sector. Counties also have a fair amount of discretionary authority, both with respect to services and other aspects of functioning. So we do some other things that are not mandated services. We have an initiative called Invest in Children. There are folks in the audience here who are involved in participating in that. It's a multi-strategy approach, working with trying better outcomes for kids 0 to 6. System of care, which is a process of coordinating care in mental health services and other services for families and children. And the emphasis there is to really tie the services together to have the family and the child at the middle of that. Amy had made a reference to the earned income tax credit, you know, which is a benefit for working families. Not something we have to do, but we put some of our money into funding a local collaboration that brings about $5 million a year into this community. Employment and Family Services, the particular part of county government that I work for, we primarily deliver eligibility for various benefit programs. Medicaid is our biggest seller. 240,000 folks in the county are enrolled in the Medicaid program. Somebody thought food stamps had a stigma, so the way to change the stigma was not to change, you know, the 30 pages of application. It's not to go and eliminate the requirement where someone has to get a letter from their landlord proving who's in the household, but they thought they'd change the name. So the name of the food stamp program is now the Supplemental Nutrition Assistance Program, and they say it's got kind of a snappy name. So I offer that to you, but in fact it does provide $200 million a year of food assistance to working families. The cash assistance program, subsidized childcare, and then what's called prevention, retention, and contingency, and you could tell that name wasn't made up by the marketing people. That's a program of emergency assistance. The benefits business is booming in Cuyahoga County. If you look at the impact of what's happened since welfare reform hit in the state of Ohio in '97, we're 139,000 households now received one or more benefits, and you can see that's, I believe, more than a 50% increase. Amy had mentioned before about the growth in coverage for children. An interesting situation, the Ohio Family Health Survey, when it was conducted, there was an oversample for this region. The percentage of Cuyahoga County children with health insurance has actually gone up. Now, half of that sample was done in July and half was done in December, so we've seen some of the impacts of the economy, but probably a significant part of that, as I think Amy mentioned, is the public sector programs that all of you pay for, the Medicaid program, and particularly the State Children's Health Insurance Program. The value of benefits that come to Cuyahoga, or the dollar value of these benefits that come to Cuyahoga County, is in excess of $2 billion a year. As you might expect, the majority of that goes to healthcare institutions, hospitals, and especially nursing homes. A precursor or an interesting note here about the economy, the food stamp program, for as long as it's been in existence, it tracks the economy on a 4 to 6 month lag. That if you had the growth in unemployment and then the food stamp numbers, you would just see it goes up and down over the years with that. That's just the consistent basis of doing that. The impact of the economy on children and families, and I don't claim any grave wisdom here. I think probably everybody in the room could hypothesize about these individual and family impacts as well or better than I can. I mean, just the effects on the individual and the family and the community of uncertainty. Whether you have a job or you don't have a job. Are you going to be able to pay your mortgage? Are you going to be able to keep your house? And how those tensions grow within individuals and family systems. Client service demands are growing. There's no question about that. At the same time, the number of staff we have doing this work is declining rapidly. There are new client groups entering the benefit system, as joblessness kind of spreads up in the class structure. And it's interesting, probably many of the people in the room, if you have good credit, you could go out today and you could finance a car, buy a car, and take it home today. So a series of, somewhat involved transactions. But if you want to get on food stamps, where the average per person benefit, maybe about $80 a month per person, well, we could probably accomplish that in about a month today. Ohio is not one of the 10 or 12 states that have invested in automated systems. 10 or 12 states like Pennsylvania, Florida, Wisconsin, Utah, you can apply for most benefit programs online. Florida particularly has made extensive use of federal waivers so as to not require face-to-face interviews to follow up on many of these benefit programs. Children, so really I think kind of the summary impact is that children and families are really at risk in multiple dimensions, and probably most everybody here is aware of the correlates of, drug abuse, family violence, other kinds of dysfunction and challenges. Looking at the impacts on the service system, no surprise, that what we do is counter-cyclical in the sense that when the economy goes south and our dollars go south to provide basic services, those are the times that demand goes up. Before we experience the upcoming state budget, we are planning on an 18% reduction in our staff this year. At the same time, we expect another 5 or 6% growth in the caseload. We anticipate the county will have to take an even tougher look not only at mandated services, but non-mandated services. I made reference to some programs, Invest in Children, EITC outreach, et cetera, things that really have a preventive potential, to either keep families out of poverty, to increase family well-being before they get involved in other more intensive systems. But when it comes down to, we do have to do food stamp eligibility. We don't have to pay for job training so someone who lost a job can get a new job. Those are going to be some of the tough choices. Beyond staff reductions, I think we're also going to be looking at some service access reductions as well. And did I get? I passed by. Thank you very much. I confess I'm not a believer in research on models of policy formation. Maybe there's a discussion to be had there. And I'd willingly talk to any of you. I always think of that as kind of voodoo economics, that such models are really most apt at explaining after the fact what happened, and it's a way of describing things. However, I do believe on research on the impacts of policies, and we have several partners here at the university and have worked very well over the years with Rob and other folks. Some questions. How do we shorten the lag between policy impact and understanding what's going on? We've done a number of things over the years. When we implemented welfare reform, we worked with MDRC that was looking at the implementation of welfare. Well, we kind of got their report about 3 years into the process, and it was a great report and very descriptive, but are there some other methodologies, participant action research, where we can build in some of these feedback cycles in the shorter term? Are there ways of kind of strengthening institutional community engagement? I don't know what the requirements are at CASE to be for tenure, but, is community engagement one of those requirements? In addition to faculty and researchers having regular course load requirements, should there be requirements for community engagement, as part of everybody's semester workload? Questions and random thoughts. How do state and local structures impact service delivery? Is it better to have this model we have in Ohio, or would we be better by having statewide models? It's certainly, I don't think we're really in a recession in the sense that things are going to come back. My personal guess, and I'd like to be more hopeful like Amy, but my personal guess is that most of these jobs are gone, and a lot of these jobs will not be coming back. So we're embarking on a new trajectory. And are there ways to really be looking at that trajectory and its ongoing impact on children and families as we go through that? How do staff concerns impact services to children and families? Just in my organization, as in many human service organizations, folks are wondering if they're going to have a job. Those folks who do have a job know they're going to be seeing more people, and the increased stress and workload that goes with that. Regarding nonprofit and government service compression, certainly we know that the private sector is shrinking. We know correspondingly the public sector and nonprofit sector will shrink. Will it be a train wreck, as some are predicting, or are individuals and families much more adaptable? If someone has a healthcare crisis, do they need the program that serves that particular flavor of disease? Or really, are their needs and willingness to address with other kinds of supportive services perhaps more fungible than we expect? What are the current community barriers to increased healthcare access? We know we have increased the enrollment of children in healthcare, but what are the barriers to really improving their healthcare outcomes? And then lastly, I made a pitch before about benefit automation. Are there ways in which we can more fully do that, make these benefits more accessible, but yet do that in such a way that low-income households, particularly those on the downside of the digital divide, do not have less access to services? And for that, I thank you.
Well, thanks, Joe. I'm less high-tech, so, and I'm also thrilled to fill in for Gayle Channing-Tenenbaum, who is one of our fantastic advocates down in Columbus. Every once in a while, the speed of Interstate 71 just isn't going to make up for the fact that I live in Tremont. So going back to the 4 questions, which was a really helpful way of sort of setting up thinking about what we're discussing today. The impact of the economy on children and families is probably a no-brainer in some regards. The recession's causing employers to cut health care for dependents, or to cut health care entirely, or to cut staff, or the amount of coverage. And all of these have an impact on children and families, which means that there's more kids, hopefully, going into the public system so they still have care. And it was mentioned before that the increase in children's insurance is in direct relation to the public investments that we've made. In 1997, we had 10%, almost 10% of our kids uninsured, and 2008, we just got the most recent data, is 4%. That's incredible growth, and that's incredible investment in our future. But we know that not all families have access to health care coverage, and those that do often find it too expensive, which makes access sort of not nearly the point. And when you've got other bills that you're looking at, rent, utilities, food, healthcare is important, but it's not as an immediate need as those other things. So it tends to take a back seat. The effect on services and policies for children and families, we've been working a lot on the state budget this year, which is a biennial budget. It is one of the tightest that we've ever seen. And Voices and our partners have estimated a $400 to $500 million gap in funding for safety net services. So this is everything from Help Me Grow, which provides assistance to young and new mothers, child care, basic food assistance, child abuse prevention, and elder abuse prevention as well. The list goes on and on. All of these are services that are not going to be funded at, or potentially could not be funded at levels that we've seen before, and they weren't invested in heavily enough to begin with. It's not like there was room for cutting in a lot of these programs. And that is a very scary proposition. And I try to, although I don't think this room needs reminding, but to emphasize that those numbers, that $500 million gap, means lives and means the quality of life for many families. We talk about them in sort of cold, sort of what percentage of the federal poverty level are you kind of ways, but the truth is that, you know, we're talking about shaping the future of our communities. If children aren't getting the kind of protection from violent family members, if they're not getting the type of education from an early age that they need to be getting, they're not going to be all that they could be. I believe strongly that every infant is just a promise waiting to happen, and how much we put in to that baby, into that new member of our community, is what determines what we get back. Let's see, that's my soapbox. I'm down and off that. How is research and policy coming together to address and inform the work? There's an interesting concept that I was going to focus on here called the welcome mat, which is that the more coverage is provided in healthcare coverage to families further up the income scale, the more people in the lower income brackets get coverage. It's a fascinating phenomenon, but there's actually been research on this in Illinois, Wisconsin, Pennsylvania, and Massachusetts, that when you expand the pool of who you're reaching out to, you also get more of the kids who were already eligible. This is a critical argument for policy advocates to make to policymakers, because oftentimes we hear over and over again, and for those of you who are paying attention to the S-chip reauthorization debates, you heard it over and over again. We're not covering all the kids that are currently eligible. Why would we increase eligibility even further? And so we have the research now to back that up. More people become aware of the fact that their family could be eligible for services. We know that early learning investments don't match up with brain development. We put the least amount of money in early care and education. We put more money in higher education, but most of the brain development happens in years 0 to 3. The most impact you can have, the most bang for your buck, if you want to put it in those terms, comes in those early years. One more example, in juvenile justice, the Center for Disease Control has found that that young people who are bound over to the adult system are 34% more likely to reoffend than those people who were placed in the community. Or, I'm sorry, 34% more likely to offend than their peers who stay in the juvenile system. So the services that are available in the juvenile system are just better geared towards helping young offenders make the right choices and make a shift in their lives rather than going to an adult system that is less prepared to do so. Finally, what data and research do we need? I sometimes think we don't have enough hours in the day to do what we need to do with the research that we already have, but there's still questions to be asked. We'd like to know the impact, the economic impact of early care and education in Ohio. We'd like to know research on the most effective models for early childhood mental health prevention. We'll say mental health prevention, mental illness prevention. We have some good investments in treatment and some good research in treatment for mental illness in young children. We don't know as much about prevention, and that really could be key. And we need more research on evidence-based practices for young folks who are being adjudicated in the juvenile system. Is it better that they stay in the community? Is it better that they are in a juvenile justice setting? What works best for them to make sure that they can make a more productive life out of their future? That's it.
Thank you. I was telling someone earlier, okay, got me down here at the end, so what could I say that was different than my colleagues here on the panel? And there are a number of points that I want to raise. First of all, I'd like to thank Jill and Molly for putting this panel on, because I think the topic is very important and one that needs a lot more attention in our communities. I'm going to come at this in a couple different ways. First of all, my research area is, or has been in the past, around the effects of chronic stress in the urban environment and its impact on children, particularly their health behaviors as well as their academic performance. But also, I'm going to come at it from a policymaker on the local level, because I do see in my community in South Euclid and surrounding suburbs and other inner ring communities the impact of the economy, and I can see it on the ground. One of the things I really want to put out here is that, there's been this perfect storm in terms of a downturn in the economy, the welfare reform that Amy talked about in terms of now individuals are out of work and do not have an opportunity or really any recourse for any further services from the government. Also, there's been another part of this storm has been the aftermath in cuts in services due to states trying to balance their budget. And we all know that many times states will balance their budget on the backs of the least of us in the communities. Now, all of this is really now starting to trickle in to the suburbs. We in South Euclid have seen a tremendous increase in the number of families who are asking and seeking support from food banks. You can go to any community that has a food bank or is considering a food bank. They will tell you that more and more families are coming there asking for food, seeking their support, and many of those have children in those families. Now, we don't have the questions up here, but I'll just start with kind of go through them. Q1, the impact of the economy. First of all, there's clearly a lack of employment opportunities. And with a lack of employment opportunities for the youth will come a lot of idle time. In about 45 days, we're going to have college kids back at home, we're going to have kids out of school, and we're going to have unemployed adults looking for work. Now, the adults will have obligations for family, for mortgages, for bills and whatnot. College students looking to pad resumes, or new college graduates looking for their first job. And then you have teenagers. Idle time, teenagers, nothing to do, that's a recipe for a problem. We've not talked about that from a policy standpoint. Law enforcement, from my chief and other chiefs in the area, have talked about being afraid of what this summer may look like without jobs. And we're not talking about that, or we haven't raised that. The area that I do research is looking at stress. Amy pointed out in terms of the numbers go up for child abuse and economic downturns. Well, think of the stress that is boiling or coming to boil in many households around the community. That stress from whether I'm going to have a job today, whether I'm going to have medical coverage today, whether I'm going to be able to get to where I need to go for a job, find a job, that's going to create a tremendous amount of stress in these families. Random violence. We see that right now among our youth. All we need to do is turn on any news channel, and we see a lot of our youth with nothing to do, who've not been guided in the schools, who've not received the support at home, committing acts of senseless and random violence. That's an impact of this economic turndown that I think we really need to get a grasp on before it really spirals out of control. As I mentioned earlier, there's been this increase in the use of food banks in inner-ring suburbs. As a social worker, we try to work with families to let them know that receiving services is nothing wrong with that. But we've had in our society, truth be told, this sense that food banks are for those people who are poor, those people who didn't take advantage of what was offered to them. Now in this economic downturn, we're seeing families who, by their own words, say, I played by the rules, I paid my bills, but through no fault of their own, now they're coming to food banks. And food banks are trying to now work with a different clientele. Heretofore, individuals who never would set foot in one are finding themselves coming. Number two, or question number two, in what ways is the economy affecting services? First of all, there's been a reduction in services targeting low-income youth. We can just look at the books. Services for youth, low-income youth, have been reduced, and they have been reduced significantly. We also now have competing agendas. Do we provide services for the elderly? Do we provide services for the youth? Who has the better proposal? Who pulls at the heartstrings of the community? Our educational programming. Can't read my handwriting here. We see school districts around this state competing or asking communities or their residents for school levies. And when levies don't pass, we all know that services are cut. And oftentimes these services are cut in the schools that can least afford them. The economic turndown has created a situation that I believe will be felt for decades to come in terms of our children's economic and educational preparation. And number three is, how is research and policy coming together? I think we can do better as researchers. I really do. And this is one event where hopefully the research that is being done here can be taken out into the community. But some of the areas that I believe we should look further into, one is the neighborhood stress. You can't tell me that walking out in an environment in which you've got to go past drug dealers, gangbangers, prostitutes, drug addicts, and just looking at the degradation of the physical environment does not affect a child's ability to learn. Not only did they leave home hungry, they go into a community that says to them, you don't matter. And then they arrive at school hungry and being told that they don't matter and they're not important, and we expect them to learn and do okay on the OAT. Family support. What is it that we really need to do to support families? Providing resources is one thing, but some families do need assistance, whether it's budgeting, managing. We know the story. We know the story of what families need, and we need to be more responsible, I believe, as researchers and practitioners in working with those families and not just saying, here are these resources, go out and do with it, and come back in 30 days or 31 days. The second or the third piece here is access to and use of technology. We may forget that not everyone has internet access in their home. We may not remember that public libraries are a place of learning. I challenge everyone under the sound of my voice today, go to a public library, pick one at 2:30, take a book and go and see if you can read there. Our libraries have become child care centers, and many of the children use those to access the internet. The parents who might want to apply for services, if we had them, Joe, wouldn't have an opportunity to get there because it's so loud. We need to look at that. And another thing that I believe researchers must address, and my colleague David Crampton will remember this phrase, parachute research. We come into a community, Rob, now Rob Fisher knows what I'm talking about as well. We come into a community oftentimes, get the data for our needs, i.e. tenure, grant proposal, grant requirements, and we leave. Oftentimes leaving the people feeling used, abused, and ripped off. This sort of parachute in, get what we need, and leave. We as researchers have got to look at that and stop and really commit ourselves to giving back to the community. On question 4, in terms of what data or research is needed, first, I got to plug chronic stress. If you look at any of the work, whether it's health-related around cancer or any other child abuse, chronic stress is a big contributor, and we need to understand what the effects of chronic stress are and how do we mitigate that for children, because children's coping skills are not the same as adults' coping skills. Whereas we may go to the gym or go to the bar, children don't have those opportunities. And we've got to understand how we can address stress for them. We've got to do a better job of communicating. We can't just put our material, researchers, into our journals and let them sit in the libraries or online. We've got to take that and translate it into real, actionable research. Translate it, make it come alive for the community. We've got to find ways to better penetrate areas in which there's high concentration of poverty. We've got to go there. MSAS is working really hard with its community and social development concentration in getting into high poverty areas, walking, knocking on doors, finding out what's needed. Secondly, or finally, we've got to do a better job of, you want to get rid of the lag time, Joe? You have in this community mayors and city councils. Those are the people who are on the grassroots. When you want to talk about grassroots, it's the local politicians. Yes, the people in Columbus control the purse strings, but it's the people in the communities who realize and see on a day-to-day basis the impact of many of those policies. And getting them involved, getting them the information will probably be more effective than spending some time on a hearing while people are running in and out. You can reach David Miller. You can reach Georgine Wheelo. You can reach Tom Longo. You can reach Joe Cicero. Those are the mayors of some entering suburbs. Our numbers are out there. You can actually come in and talk with us and see us. So those are the individuals that information, if given to them, can get out and things can be done. And I want to say one thing about political will. I know I've kind of gone over my time. Amy, and I agree with you. And we really have to think outside of the box. When I arrived in my little Volkswagen in Pittsburgh in 1989, there was mile after mile after mile of closed steel mills. And what you heard in Pittsburgh is what you're hearing now. We're never going to have these jobs, or they're not going to come back. What are we going to do? Pittsburgh sucked it up, had the political will, and it's changed its economy, it's changed its community. And it's one of the communities, it's dealing with the economic turndown. but it's one of the communities in which the impact has been lessened because it said, we're going to use what we have to make our community better and stronger. And we in Cleveland have to take the researchers and hold the policymakers in the community as well as in Columbus, hold our feet to the fire to address this, because we have got to pull this up, because we don't have a lot of time to waste, because our children, much less they're not seeing dentists, many of them aren't seeing economic satisfaction through their families, and they're not seeing academic success. So it's up to us to take the research that we so gratefully put into our journals and really translate that into something that will be useful and change lives of our children, because this is about children, and that's what the Schubert Center is about, changing the lives and impacting the lives of children and their families. Thank you.
Well, talk about a hard act to follow. I'd like to thank our panel so much for their comments. And our intention really was to bring these diverse perspectives together, including all of you, so that we could engage in a discussion now encompassing. I'm sure the panel has more things to say, questions to ask each other. I'm sure the audience has things that they would like to say or add or ask. So we'd like to open this up. I think that the powers that be would like us to ask our questions into the microphones if we can. So I'd like to open this up to comments, discussions. I'm busily trying to remember everything that everybody said here, and thank you so much for your perspectives on this, on how we really begin to bridge these gaps between research, policy, and practice. The wonderful thing about people who work with children is that we all really have the intention of improving their lot, and how we go about that, I think, is critical to all of us. So who would like to start with a comment, either from the audience or from our panel? Rob. All right.
Really, hello. It's really helpful dialogue. I really appreciated the diversity of perspectives. I guess one thing that came to mind is in Cuyahoga County, we're unique in a number of ways, and one of them was mentioned, which is this 10-year commitment to a public-private partnership around children, the Invest in Children project, which is now 10 years of age this summer. And my question is, with all of these changes and tightening of budgets, what I'm observing is a straining in our sustainability of such efforts, and frankly, perhaps a pitting of allies, former allies, against one another. And I'm wondering if any of you would venture to offer a thought along those lines, because if you sit around a table with collaborators, something that is under the surface is who pays most of your bills. And some players are mostly state-funded, others may be foundation-funded, some are funded by local government. And for example, state dramatic cuts of Help Me Grow, cutting half their budget in the next year, might lead to cases where the phrase bang for the buck was mentioned. We can make different arguments based on what might make the best investment along our continuum of services. And how do we hold together these successful collaborations in the face of these threats?
Well, I'm certainly glad that we had the easy question first, so we can address that and then go on to the more mundane ones. Yes, no, okay, I think that's great. I wish I knew the answer to that, quite frankly. Part of what we're faced with in county government itself is this mix of discretionary things we do, like invest in children, and things that we gotta do, like we gotta investigate allegations of child abuse, we gotta process food stamp applications. I think you did an excellent job of describing the dynamic at play. And I think particularly what we're starting to see on the state budget is this sense of folks kind of being pitted against each other. I know those of us in the public benefits realm, you know, we have a push now, we're trying to find some $50 to $60 million. You know, and obviously, if somehow some of that money is going to come back to help keep the benefit machine going, then that's got to come from somewhere, you know. And, you know, where is that going to come if we're in an environment where there's not going to be an increase in taxes? What will carry this community well, I think, is the fact that, you know, most of the people in these kinds of roles, advocates, and researchers, you know, these folks are not strangers to each other. I mean, there is in this community and probably other parts of the state a pretty tight-knit community of advocates. And so I can't rule out some of that people going after each other, if you will, because I think that will be a part of the state budget process, at least going after each other's money. The fact is, though, that we're blessed in this community to have a wealth of advocates and informed researchers who have a history of collaboration. And I think that will help us. But I'm not quite so sure what will solve the full issue.
Well, I don't want all of us to weigh in on every question, so if you have more to say, I have a quick comment. Let me make a quick comment. I just want to say, you know, I think you've raised a great question, and to me, the core of the answer to that question is that we have to pay attention to the revenue side of the budget. We have had a generation of tax cuts at the federal and the state level. We have had a Republican governor and legislature who pushed through a set of very unsustainable tax cuts that's put a huge hole in our state budget, and a Democratic legislature and governor who came in and continued to implement those tax cuts. And at a time and in a way that, you know, I think the governor has done many good things, but in a way that makes it impossible to fund the very important things that we need to do. So, you know, we are twice as prosperous as we were a generation ago. We can afford to have both food stamps and invest in children. You know, we can afford to have early care and education and dental care for kids. And, you know, I think it's a matter of making clear that we have to reverse the tax policy that we've allowed a very ideological group to put in place.
I would just want to add to that. I think that the collaborators that you talk about, Dr. Fisher, somehow we've got to get them to realize that how do we make the situation win-win? Because as long as they compete against each other, that will continue to keep, I think, those revenue streams lower. Also, I guess in the same venue is this sort of zero-sum game that we play in community services. We have to really put that aside, and whatever that goal is, what's the overarching goal? Is it to say, I got an increase in my budget, or we came together and did what we could do best to help the families and children? Because, you know, if one agency can do A better, they do that, but maybe with the support of another agency that does X better, they work hand in hand, as opposed to having this conflictual model that we see, and I'm sure you see in your evaluative work.
Just a quick follow-up on David's comment. As far as working together, I think is important, and I've learned a lot in the Schubert Center, where colleagues of mine are going into the same schools that we're going into. It would be a lot nicer if we do this in tandem. So we can use, you know, David's resources, my resources, other resources in the schools, and work together, not work apart.
I would also just add that now is the time to work those networks like they've never been worked before. And the way that you do that is communication. At times like this, we become very insular. You know, we want to protect our own budgets, we want to protect our own pieces of the pie. But now more than ever is the time to get out there and tell your partners what you're doing. Ask them how that's going to impact what they're doing. Look for ways to collaborate with each other. If folks aren't using those networks, I mean, we go to meetings after meetings after meetings in this world, right? We should be talking with each other on a daily basis, not just a monthly basis, and making sure that those networks get worked. They're there for a reason.
Great.
Okay, I'll take it on. Thank you for the panel. It was a very helpful discussion. I do guardianship here in the county with kids at risk. And so I see some of the stress that Mr. Miller talked about community-wide and in kids. One of the questions I have is that while we've had some research that says 0 to 3 is the biggest area of brain growth and development, the love of learning and learning skills come somewhat later. You know, if you know how to read, you can teach yourself anything at some level. If you're excited about school, the world can really open up. And one of the things that really troubles me is that when you see a family at risk, or either through conduct of their own, one of the parents is removed from the household because of drinking or drugs or something like that, or just because of the risks of life. You know, an older sibling gets sick and the whole family suffers, and the younger kids, lose the attention of the adults in the household that they need to nurture and grow. How is it that we can do anything to try and, is there a research out there that can say we are going to be able to continue the progress that a child has made despite the stresses that they're getting, and that maybe minimizing the individual stress that the child is receiving, and be able to keep him on a track that might be productive? And that's one of the ideas I'm looking for. Is there a way of trying to help minimize the impact on the rest of the kids, things like that?
Thank you.
All right. Everybody's like, everybody's looking at you. I think one of the things we can do, sir, is give of our time and make it really simple. Kids want to see somebody else in their community care about them. And I know we all have tremendously busy schedules, but sometimes we have to step back and say, how do I give a kid my time? If it's nothing but going to the school and asking, can I read to a second grade or third grade class? It's going to a community center and saying, I know a little bit of math, I know a little bit of science, I can get someone else here. We're going to take 3 days, 4 days out of over a month and help tutor kids on the OAT or some other achievement exam. Sometimes the person or persons that can best help kids stay on track is that person that looks back at us each morning when we go and brush our teeth, comb our hair, put on our clothes. That's the person that those kids need to see. There used to be an old, well, I saw it many, many years ago, and it was the Family Circus cartoon. I'm sure all of us have seen it. And it talked about we give our kids all these things: iPods, cell phones, video games, Wiis, this, that, and the other. But what our children really want is our time. And we have to make a commitment to give our children our own, and as well as some of the other kids in our community, our time. Whether it's volunteering to coach, lead a scout pack, or again, just helping them, showing the kids that we care. Resilience research talks about protective factors. Some kids don't have enough individual protective factors. They don't have the family, but there is one that we can use, and that's the community protective factors. And my research and research of others indicates that some of the most resilient children are those who will say or can report, there was someone who believed in me. And that person believed in them because they spent time with them or they showed them that. And I think that, for me, is one way to continue that progress.
You know, I'd like to speak to both those questions briefly, and David and I were just having a conversation about this. One of the things that you're talking about with collaboration is dealing with that handful of agencies that are providing Help Me Grow services. But I think we need to look more broadly at a different kind of collaboration, which is kind of like the dental program. David has all of this research about the impact of stress on the lives of children and how it impacts their learning. But we need to transfer that research and work in collaboration with the education providers to talk about interventions. How can this research inform practice? And then how can we analyze the interventions that are being used to see if they're useful. That's the kind of collaboration that we don't have in our area, I believe. And as both a researcher and a practitioner, I think that we're just ripe and ready to move into that. And I hope that, David, that we'll be able to do some more collaboration between our programs.
Look forward to it.
I have two issues. The first is asking, is any research being done at the amount of money and time devoted to paperwork? Joe, you just indicated that it takes a month. I'm sitting here saying, oh my gosh. I mean, a month to get food stamps. This is absolutely crazy. What happens to our families waiting for something to happen is so, I mean, talk about stressful, that's what it is. The other issue is, if I look at my own program that I work with, and all the programs, I happen to be housed at juvenile court for a mere 29 years. When we started, we had all these people, we had 30 people at a table doing prevention. No one's doing prevention. We've also hired people that are absolutely great case managers, which really correlates with being a verbal person, and we're asking them to spend 20 to 25 hours a week documenting what they do in such a way to get the Medicaid payments. And every time I go to a meeting, whether it's on the county, state, federal level, who could do some research to correlate how much money we're spending on doing this paperwork that really nobody ever reads except people who come in to document our books? Now, I don't know if anybody else sees this as a critical problem, but I'm thinking if you wanted to double a caseload, it'd be really easy. Just get rid of, we were doing fabulous work before, now we're doing half the work because we have to document it. And I have one other question when you answer that one.
Well, in terms of the public benefits, there's really no one doing that. In fact, you might think, though, the state's role is to write rules for us, and they say, okay, now we need to collect this thing and this thing. They do not have a model that allows them to capture the impact of their regulations. Also in Ohio, we have a model where the caseworker, literally a public employee, is the only individual who can enter a keystroke of data. So in some cases, if somebody goes to the emergency room and isn't on Medicaid but might be, the hospital has them sign this form saying, hey, this guy might be eligible for Medicaid. They could send us that data electronically, sometimes they do, but when we get it, we then print it out and put it in a sheet of paper, and then we have one of our caseworkers who probably do 20 to 30 words a minute, maybe a little better, a little worse, go and enter stuff in keystroke by keystroke. There is potential there for immense savings. In the state of Florida, in the public benefit system, between 80 and 90% of the data is entered either by individuals or other individual applicants or other community assisters. And speaking about the second part of what you're talking about, the documentation of case record, my sense is that is not atypical of what we're doing in the overall area of health payments and health insurance payments, that folks are wanting to be sure that services are necessary and appropriate. But I would personally see that as a great place for research, and how does one increase, not only improve the efficiency, but is there a way to increase health outcomes if people just spend a little less time, entering all those keystrokes?
It just seems to me that if we had somebody doing the research, Molly and Jill, and looking at it to present it somewhere, I don't think any of the institutions can actually do that kind of research, but we could provide the numbers to show you how much time people are spending on this paperwork and the cost, per hour. And we have a whole floor of people in all these different agencies now that's all they do is monitor paperwork. They're not doing any direct service whatsoever. This just seems absolutely crazy to me. And it's like the buck never stops anywhere. Nobody's saying enough. And it's everybody who comes in, they want more information collected, but nobody ever takes away anything. So that's just fuel for thought. Okay. The other issue is that we allude to it, but we don't say it. And I forgive me if it offends anyone, but we got into this mess by people, buying homes they couldn't afford. And I'm at juvenile court every day, and I'm seeing people having multiple children that they can't afford. And the stress on a child, I'm sorry, you just can't build anything in to replace mom. These kids are taken out and they're in, 15, 20, 25 foster homes in their life. It is, to me, it is a crime. And I can't believe I'm even saying it after all these years, but I've kind of come full circle, I don't know what to say to these kids, and I often say to them before they go into court, the judge can't do anything worse to you than what's been done in your own life. So I think at some point we need to look at the policy of, yesterday, we had a murder case and there were like 8 siblings there and everybody had babies with them. And it just hit me. And that's stressful.
Absolutely. The first part of your question, I think, regarding paperwork, I think the Schubert Center, and we've been meeting well over a year to talk about ideas, and I think that's an area which I'm sure Jill and Molly in their capacity will probably put on the table on the agenda. But we have a gentleman, I have 2 of my colleagues, and I know I've named them, but I'll name them again, David Crampton and Rob Fisher. I mean, they have the skills to really probably give policymakers the information they need to do, they could do the research, turn over the information to the policymakers to show how savings can be realized. But again, as Amy said, there has to be policymakers with the will to do that, not looking at the next voting cycle.
What this economy has provided for us is an unintended consequence that not as many children are taken away from their parents because we can't afford to. So while it's happening for the wrong reason, the right outcome is happening. We're trying other things that are cheaper. So the policymakers, when you go to the legislature, we got some laws changed about incarcerating children based on telling them it was way too expensive. Not that it was bad for children, but it was too expensive. So if we could get a cost benefit, then I think you could get the legislature to listen because of the finances, even though it's the right thing to do.
Mm-hmm. Oh, I agree.
Did you have something you wanted to say?
I think Jim and I both do, wasn't it?
Yeah.
I'm sorry, David, I didn't mean to cut you.
No, go ahead. No,
Okay, just about the paperwork. Yeah. One of the reasons that my friends in the dental practice arena don't take Medicaid children is because of the paperwork. And they would rather just take the children, do pro bono, and just do the care, but not deal with the paperwork. It's just too cumbersome. So you're right.
And I'll just say, I think with that, again, it's a matter of will. It's a matter of a decision that it's more important to document every single penny spent than to take the risk that some kid who actually could have maybe eked out a way of having his parent pay for that service gets served. And so it's a hostility toward the poor that I think was engendered by the kind of Ronald Reagan welfare queen metaphor that was a really inaccurate metaphor. So, every other industrialized country manages to provide universal health insurance to everyone with much less paperwork. So I would argue that it's actually not just uniquely a problem in the system of how we deliver health care to low-income people, but just in our entire healthcare system, which is this market-driven system that preserves extreme profits for insurance companies and lots of jobs for insurance companies at the expense of providing service universally. Quickly on the issue of births to people who are unable to care for the children, I'll just say the single best way to reduce birth rates and have young women delay giving birth is to give young women educational opportunities. Young women who feel that they have educational opportunities are not going to get pregnant. Sarah Palin's daughter aside. So, I think that it's really, that's something where the research is very, very clear, that young women who sense a future for themselves are much less likely to give birth. And obviously, providing, universal access to birth control and family planning services is helpful there too, because it's not always an intentional thing to get pregnant. But, I think that providing educational opportunities to women is the best way to handle that.
David, I cut you off, and then Erica.
No, I'm fine. I'm fine.
You fine, Erica?
Just really quickly, because I know we're running short on time. Excuse me, 2 thoughts. One is when you find out how much time folks are spending on paperwork, then the trick becomes the communication of that information. So you want to be able to tell people that, you know, $20,000 of every $40,000 that the average caseworker is making, and I know they make less than that, you know, is going towards paperwork, and aren't you actually paying them to care for kids? You know, that type of thing. I think of the messaging that Policy Matters did around the payday lending places, and something that's visual, right? They said that there are more payday lending establishments than fast food restaurants combined in Ohio. That was something people could see. So I think the communication of that information is key. And then the other thing I would say about the teen pregnancy is I've come more and more to believe in the power of mentoring, and then the need to get successful women in front of younger women and show them a different way. We do what we've seen. We do what we know. And you know, in another life I taught college. I had a student, brightest woman I think I'd met in years. Everyone in her family had had a child before they were 21. And she fought to be able to not do that, to explain to them why she didn't want to have a child, and still ended up having a baby and making her life much more difficult. Now, she's a resilient woman who got her degree. But you need to have that example. You need to, you know, I think of those young people at the school that Michelle Obama went to. That young women are now seeing a woman who chose her education over the immediate problems in front of her, and made different choices, and what that yielded. Now folks can see it, and I think that's really powerful for kids.
We are truly out of time, so let's have one quick comment and then we'll thank you.
Yeah, I'm a retired OBGYN, so I've done some of this stuff, started the first inner city health clinic in Ohio at East Cleveland. There's a lot to be done, keeping it simple, using our resources well. In Cleveland, we put tons of money into schools that we close at 2:30 in the afternoon. If we could only run 2 shifts, use them as community centers. I understand about the janitors union, which is, I can't believe we let the janitors union run the school system in Ohio. That's what we're doing. But our schools could be used for all the things you're talking about. I've been involved in all this extra paperwork, and I will tell you, I've gone to the president of our university with an idea that we do some research here on healthcare policy, using every single college in this university. I don't know that it'll ever get done, but there's a lot of good stuff that we can do that would be simple, use our resources well, and just get down to doing what we know works. We know what to do. We just don't have the will to do it yet.
Well, with that, I'd like to thank everybody. I know we'd like to go on for longer. This has given us a lot of food for thought. We hope further conversation. If you're not on our mailing list from the Schubert Center to get notice of events and talks, and hopefully we can continue this discussion and not have it just be a nice panel and we're done. We'd like to continue these conversations very much. So if for some reason you're not on our mailing list and don't get our emails, stop by and give Jessica McRitchie, who organizes everything for us, in the back that email. I'd really like to thank our panel again. These were such important and meaningful comments, and I'd like to thank the audience, and let's maybe continue informally for a few minutes, and we'll try to reconvene us all.
Thank you.
Great, thank you. Amy, I'm going to run. Good to see you.
Yeah.
Good seeing you. Take care.
No.